thanks for joining us. I have Dr. Mintle with me right now. Appreciate it, Linda. And you have such an eclectic background, very diverse. You've written a recent book called Living Beyond Pain. You're a licensed marriage and family therapist, and I'm thankful for you joining our summit.
Thank you. I've actually got several licenses, and I have a PhD in urban health and clinical psychology as well. So I've been involved in the mental health field as a family therapist, as a clinical social worker, in psychology. I've got all these backgrounds that have come together in treating people. And I love that because I pay attention to not only the individual, but I also do a lot of family work, couples work. And when we're talking about pain, a lot of people don't realize, Marcus, that your relationships can actually make your pain better or your pain worse. The relationships are important in there too.
And that's really interesting. If you go to your website, that was one of the first things that I read, that I was learning that you're a relationship expert.
Yeah.
And yet you're writing a book about pain. So how does that tie in? How could we apply your background with relationships and psychology to managing chronic and persistent pain?
Well, pain is in the brain. So we like to tell people that the bane of pain is plainly in the brain. So if you don't have a brain, you don't have pain. So when somebody hurts themselves and they feel pain, they're really not feeling it here or in their neck or their back or wherever. They're feeling the pain in here because it's a perception. And the way I like to help people with this is, one of my favorite places in the country to go to is the MoMA in New York City. I love the Museum of Modern Art. And if you go there, you'll see a picture of Starry Night by Van Gogh. And when you stare at that picture, you'll see something in that picture. And when you ask several people who are looking at that picture, what do you see? You will get a whole bunch of different responses. When I look at it, I see chaos and depression and just kind of the swirling of the night. If you asked a physicist, they would tell you that they see the mathematical theory of turbulence in that picture. So very different. And how that relates to pain is when you have an event, it may be the same stimulus. You may hit your hand with a nail or you may injure your back. But the perception of that is very different from person to person. And so because pain is a perception, depending on your life experiences, depending on your relationships, depending on your emotional state, depending on the way you think and what things you believe, all of those things influence your perception of pain. But the good news is, because your mind influences pain so directly, you can change your beliefs, you can change your emotional state, you can change your lifestyle, you can change your thoughts. And all of those things, when you change them, can turn down the volume on chronic pain and actually make your pain better or worse, depending on which way you go.
It reminds me of this saying that a coin has two sides, or like a coin has two sides, but a story has three sides to a story. We could all have different perceptions and interpretations of an event or a stimulus. When it comes to pain, are there different types of pains that people can experience? Because a lot of times, a doctor might prescribe a medication if somebody comes into their office. Let's say they're dealing with sciatic nerve pain, and they might get prescribed a muscle relaxer or a high dose ibuprofen or diclofenac.
Mm-hmm.
Are there different types of pain that need to be managed differently?
There are, and I co-wrote this book, I wanted to say, with a physician who is boarded in osteopathic neuromuscular skeletal medicine. So he uses his hands a lot with chronic pain patients when he does his OMT, which is the osteopathic manipulative treatment. A lot of people aren't aware of that. And if you have a structural problem with your pain, he literally is manipulating the body and helping that pain by what he's doing to the fascia and the way he manipulates with his hands. So he is also a pain specialist. So he would be the first person to tell you, and he wrote a lot about this in our book, that you can have nociceptive pain, which is the common pain when you get injured or you have something happen to you. Or you can have neuropathic pain, which a lot of people know as nerve pain. And sometimes people might think of that with diabetic neuropathy, or maybe shingles would be an example of a nerve pain. And then you can have inflammatory pain, You can have psychogenic pain. You can have a lot of different types of pain. The point of that is that you and I both share something, I think, in common, that we both believe that it's very important to get to the root of the pain. So if it's structural, it may need a structural approach. If it's more of a neuropathic pain, you may have to do some things to help calm down the central nervous system and do some changes in the brain so that those pain pathways are not getting so activated so quickly. Because one of the problems in chronic pain is that there is this process of central sensitization that happens in the body where the central nervous system kind of winds up, and you get triggered more often with pain. You feel pain more intensely, some people do. They feel it with light touch, maybe somebody else wouldn't. And the brain actually rewires towards that pain. So it's a little bit like an alarm clock that's misfiring, you know, an alarm system. Pain is protective in the body, but when it misfires and it tells us that there's pain and there's really not, that can be an actual problem.
Yeah, it's really fascinating what you're talking about with neuropathic pain developing and how pain can get increased. There's different modifiers like the spinal cord, the peripheral nerves, which are the nerve endings in the actual tissue. And like, let's say you had neuropathy in your feet, and there's the nerve endings there, and then those signals get sent to your brain, and then your brain then interprets that as pain.
Right.
And so,
and we can influence that. We can influence those pathways, and especially that central sensitization that's going up into the spinal cord, goes into the thalamus, a part of the brain that people can think of as the air traffic controller of the brain. And one of the things that we know that's really important in mind-body treatments is that the emotional parts, the emotional pathways in the brain and the pain pathways share the same real estate. And that's one of the reasons when we're talking about mind-body treatments, that if you're very depressed, for instance, and you know, a lot of people get depressed when they're in chronic pain, or they were depressed before and then it worsens their pain because those pathways are very similar. So one of the treatments is to really calm things down in your life, get treatment for that depression or that anxiety or those catastrophic thoughts that you're thinking, because when you treat those things, you're actually rewiring the brain away from the pain. So there is a lot you can do with your mind to change that pain perception that can really help with chronic pain. Now, when I say that, I don't want to give anybody who's watching us the impression that that pain is something that's just made up in your brain. It's not, it's real. And I have a lot of compassion for people who experience chronic pain because it's very, very difficult on a day-by-day basis to live with that. But we do want people to understand that there are many, many techniques, therapies, treatments, interventions that you can do to turn down the volume of pain in your brain and work on that central sensitization that has happened in the body so you can calm down that nervous system so that we can get those pain pathways functioning better.
yeah, I love it. And like what you said, you're not saying that there is not something wrong with the body.
Right.
That can happen if you have a tendonitis, a tendinopathy, a disc pushing up on a nerve. There could be some physical components of that, but the way that you interpret that pain is really coming from the brain. I mean, all pain is essentially coming from the brain.
Right, right. So it's real. It's real. People are not making it up. But the way that all of that has changed, it's through a process called neuroadaptation, which is just a really fancy way of saying that the body can change as a result of experiences that you have. And so what you have to do is learn, what can I do to calm down that nervous system and change that pain perception? One of the things that people don't think about that is very simple is just distract yourself away from the pain. So that is the thing I did not know when I went through a year of really bad, awful chronic pain. I was giving all my attention to the pain. I would think about it. I would focus on it. I would tell myself, this really hurts, which it did. But the more I was doing that, I was actually making pain worse in my brain. And now we know through a lot of things that people can do, just distract your activity. This is the basis of all mindfulness, is to distract away from the pain into something that's more calm or something else. It's actually the basis of hypnosis. Hypnosis is actually a distraction in the brain away from the pain. And those techniques work because they form a distraction and they move the brain to a different pathway away from that one that's been so rotor-rooted into the brain, so to speak.
Yeah, that's great. I was going to ask you about some specific techniques or strategies that you like or that you've done with some clients or that you've wrote about. So distraction is one of them. Is there anything else, when it comes to rewiring the brain? What are some more tactical strategies that somebody can think of or
There are so many that people don't talk about. So biofeedback, a lot of people have heard of biofeedback, and basically you're learning by watching. You hook up to a machine, you watch your physiological responses on the machine, and you learn by watching it how to calm down your body, to breathe, to watch the signals. It teaches you how to get that nervous system calmed down when you're having a pain experience. We use this a lot for migraines. I actually have a biofeedback machine, neurofeedback in my office, and we teach people by watching on a screen. And there have been lots and lots of studies on this where you can decrease migraines so many a month by doing biofeedback. So you learn how to take voluntary control over something that feels very involuntary when you first experience it. That's a great way to deal with chronic pain. Also, I mentioned hypnosis. Hypnosis does seem to work, and we think it's because you're focusing on other things other than the actual pain itself. So any technique that moves you away. I mentioned mindfulness techniques, relaxation. Now, a lot of people are very wound up when they're in chronic pain and your body gets tense. And if you learn how to relax your body, you do some deep breathing, deep diaphragmatic breathing will help calm down pain, chronic pain. Progressive muscle relaxation, where you're tensing your muscle and then you're relaxing your muscle. I've had several of my patients practice relaxation techniques when they wake up first thing in the morning, when they go to bed at night to get them to a state of sleep. And they get so good at practicing it that they can be sitting in their car and they start to feel a lot of pain, and they can literally just cue themselves to relax their body, and the pain will decrease when they do that. So there are also things called guided imagery, where you can listen to a tape of somebody walking you through a beach, and they're engaging all five senses, where they're having you think about the waves and the crashing sounds and the heat of the sun and underneath your feet. And you can do this in a virtual sense too. So there's a lot of promise with virtual reality types of guided imagery, where you put people into a very calm scene with the virtual reality technology, and we're having really good success helping people with chronic pain with that.
Yeah, the virtual reality is very fascinating, especially because of where we're at with technology and being
Right.
in an environment. But the graded motor imagery is really fascinating. And Lower Mosley, if somebody wants to get into that
Yes.
research more, you can head over to his material on his website. And he's one of the most world-renowned experts on pain science and graded motor imagery and walking your body and mind through these different activities to eventually get you to be less sensitive. So that's what we're essentially trying to do.
Yeah, and I read a lot of his stuff when I was preparing for the book. And, one of the most intuitive ones is that exercise. People want to avoid exercise because you hurt and you don't want to do it. And so you get more and more sedentary, which is just making things worse and worse and worse. So one of the best treatments for a lot of things these days is exercise. I mean, exercise helps with stress, with anxiety, with depression, with so many conditions that people have, but it actually is one of the keys to getting back into a better quality of life with someone who's a chronic pain sufferer, starting slow, doing it under some supervision, somebody who understands. I had a lot of my patients work with an exercise physiologist just to get them to a place where they were doing it very slowly and regaining their strength. So I'm a huge believer of Pilates. I think Pilates is one of the best things you can do for the body because it gives you this core strength that you need, which is really essential in treating chronic pain. So strengthening the core and being more flexible and moving your body is one of the biggest things that people can do to help themselves with chronic pain.
Yeah, and especially when you combine that with all the other techniques that you mentioned, that's how you can start to tackle this beast, so to speak, this monster. Right? The way that people describe their chronic pain, it's very impactful. I run a few different support groups for specific injuries like meniscus tears and sciatic nerve pain, and people are dealing with real pain. I mean, they're having a tough time getting up in the morning. sometimes they're having almost suicidal thoughts, like they don't even want to live anymore because the pain is so bad. And so that's playing a huge role in their mental health as well.
It is a risk factor actually for suicide. Chronic pain is one of the risk factors that we know for suicide. I mentioned that I had a bout with this. So I was an ice skater when I was a kid, and when I was in my 40s, I was going to show off to my kids how well I could ice skate. And I ended up trying one of these flying camels, and I landed wrong, and I injured myself very badly. And I ended up having a huge bulge on my L5 and my back pain. And I've given birth, Marcus. I've never felt anything so horrible in my life than that injury. And it went on for months and months, and it sat on my sciatic nerve. And I didn't know all this. I just knew that I hurt. And I went to multiple doctors. Nobody could figure out what the source of my pain was. I put it together when it started, but it progressively got worse and worse and worse, to the point where I couldn't even stand. I couldn't sit. I couldn't sleep. I actually was on my stomach, was the only place I could get relief for a couple of months until they could figure out what was going on with me. And I actually went to an acupuncturist, and he was an MD who did acupuncture for chronic pain. And he helped me, and acupuncture is one of the evidence-based treatments for chronic pain. He helped me, but it would only sustain for about 3 to 4 hours. And then I would be back in horrible pain again. And I can tell you that if I could have tolerated the narcotics, the opioids, because I was prescribed those by multiple doctors, but I get violently ill with narcotics. I can't tolerate them at all. Thank goodness, because I probably would have become addicted to them. Because I remember thinking, I'll do anything to make this pain stop. It was so unrelenting. And you're right, you don't think about anything else, which again, remember that whole business, pain demands attention. And when you give it attention, it makes it worse. So I was attending to my pain. I began thinking catastrophically. What if I can't get up and take care of my kids? What if I can't get back to my job? What am I going to do? All that catastrophic thinking also increases the perception of pain in the brain. And I was at my wit's end of what to do. Now, for me, the acupuncture physician said, something's wrong because this should be working, sent me for an MRI, and that's how they diagnosed what happened. I had to have surgery. It was not an option. And I had a really good surgical outcome because of that. But when I was done post-surgery, the doctor, the neurosurgeon, who was fantastic with the surgery, just said, well, okay, bye, great, it was great, you had a good outcome. No post-operative instructions at all. And I was in a lot of pain post-operatively, and I couldn't take narcotics. That's when I started doing the research, and I started doing Pilates and got into very slowly moving my body, getting in. And I'm telling you, I think Pilates brought me back to life again. And I'm great today. But everything that I wish I would have known, I put in this book because I wish I would have known all these other things that would have helped my pain, the mindfulness, the distraction, the biofeedback approaches, the acupuncture I did try. There are other things that you can do that we put, there's interventions that Dr. Cribbs can do with injections and all kinds of other things that could have helped me during that time. One of the things that people don't usually think about is your diet, and just an anti-inflammatory diet. So we looked at all the diets, and we landed on, in the book, the Cleveland Clinic diet, the anti-inflammatory diet, because taking down the inflammation would have helped my chronic pain as well. So I'm really into this book because I went through it. I literally do feel the pain of chronic pain patients. And I tell you, if I hadn't gotten the help I had gotten, I don't know where I would be today, because I've honestly never experienced anything like that in my life. It's just a horrible thing to have to deal with day in and day out. So we have to have a lot of empathy for people in pain, and we need to give them tools and techniques. If we've got a moment, I want to tell you what our approach is to this, because I think it's a really good way to help people think about it. So Dr. Cribbs' wife is a very big fan of the Tour de France. So if you don't know what that is, it's a big bike race that they do over in Europe every year. It's 23 days, 21 legs. It's grueling. Well, the British team had never won this race in 108 years. And it was over 100 years. I'm thinking, I'm a Cubs fan, and we hadn't won the World Series, I think it was, in 108 years. So I can relate to the Tour de France and the British team, right? They were so tired of losing. They hired a coach, a new coach, came out of the business world, and he brought this concept called marginal gains. And what that means is he looked at every single aspect of riding a bike in that race. So he looked at the handlebars, he looked at the seat, he looked at the spokes, he looked at the background of when they hung the bikes. If it was white, they could see dirt better on the bikes. They looked at the way, the diets of the riders. I mean, everything that you could think of that would go into that race. And he said, if we can improve each aspect of riding that bike 1%, the cumulative effect will be that in 5 years, we'll win the Tour de France. So he worked on every aspect. So he worked on improving the seat, the handlebars, the brakes, the spokes, the wind velocity, the helmets, everything 1%. And in 3 years, they won the race. Now, they never won any of the legs, but they won the race. And we thought that was a wonderful metaphor for what you need to do with chronic pain. You have to address all kinds of issues in your life. It's holistic. You have to address your diet. You should address your weight, because the more weight you have, the more pain you have. You should address hydration. You should look at if you're drinking alcohol, because alcohol doesn't help chronic pain. It medicates it temporarily, but it makes things worse in the long run. Smokers have more pain than non-smokers. We looked at the brain in terms of your beliefs. The way you believe affects your pain. The way you think affects your pain. The way you feel affects your pain. Your relationships. If your relationships are enabling and people are paying a lot of attention to your pain, that's going to make your pain worse as well. So we looked at all aspects. We looked at the spiritual lives of people. People that don't have meaning or purpose in their life engage in hopelessness, and their pain gets worse. And in the worst cases, it can end up in depression and suicide. So we looked at all aspects of the person, and we're saying, if you go through a program and you improve all of these aspects, maybe even more than 1%, your cumulative effect will be you'll win the race against pain. You'll improve the quality of your life, the quality of your function, and you'll feel so much better.
It's a lot like the principle in the book by Darren Hardy, The Compound Effect, where it's just small incremental improvements just done day by day, even if it's the smallest achievement. But then if you look at the results in 2 years or 3 years down the road, then you're much better off. But it's so hard to see that for somebody who's dealing with the pain, because you're celebrating a really small accomplishment, which might be just waking up without pain. But then when you start to walk, then the pain comes back. So if somebody's just trying to make it through the day, it becomes very hard. And like you said, you need that program, and you need something that's very comprehensive, that addresses all the different components of pain. And oftentimes I feel like people do not see significant recovery or get significant pain reduction because they might just be working with only one person that specializes in one area, but they might have some physical components of pain, and then they have the relationship aspects of it, and then the stress and anxiety, and then the hydration, and then the diet could be off, and so, or they can have problems with sleep, and there's so many things to work on. So
yeah, but you're right, you got to stay motivated, which is why you probably need to work with somebody, even if you got a life coach, to say, let's go through a book like this, and let's take all those aspects, and let's see if we can just keep moving forward with that. Because you're right, it's harder to change all those aspects of your life. I mean, think of when you just want to make a change at New Year's, and you say, I'm gonna eat better, and most of us are off that in about 3 weeks, because it's hard work to do those things. So I really encourage people, you have to stay motivated in this process. You have to look down the road to the end of the race. Where am I going? And am I on that pathway to get there? That's much harder than taking a pill. And I understand why people would sometimes rather, it's easier to take the pill. It's not as effective though, and it causes a lot more problems than we want with some of those pills. So doing the hard work is much more difficult, but it will pay off in the long run.
if somebody wants to learn more about your book, where can they do that? Where can they access it?
Well, I have a website, drlindamintle.com. So it's obviously on the website, but it's on all the main online, Amazon, all the places that you look for books. You can find me. If you just Google my name, Dr. Linda Mintle, it'll come up in some way. But we really wrote it with an empathetic heart towards people with chronic pain. And we wanted to give people an understanding of chronic pain. So there's a lot more than what we talked about there, but also a lot of tools to be able to combat chronic pain and to really take your life back, because that was really the thing. You got to take your life back and be encouraged that you can do that.
Absolutely. It's a beautiful message. More people need to hear it. And that's one of my main goals, is to get a message like that in front of as many people as possible, because like you said, there are millions of people that are dealing with chronic pain.
Yes.
There's a statistic, I think 128 people per day were dying from opioid
Right.
overdoses in the United States. This was in 2018. So it's, the numbers back it up. The numbers are showing that this is a major problem. But even more important than the numbers, these are actual, these are moms, these are dads, these are teenagers, these are, people who have, to provide for their families, and so they need to be healthy and they need to be pain free, or at least be able to function. So a book like yours I know it's helped a lot of people, and it's going to continue to help a lot of people. Well, at the end of these interviews, I also like to ask if you have any kind of free gift or resource, or just a way for people to get in touch with you. You can feel free to share that right now.
Well, so the website, drlindamintle.com, there's a free e-newsletter that comes out every month, and there's blogs on there. I blog. I'm a national blogger, so I blog twice a week on a lot of different topics, a lot of times on pain, but also on relationships and mental health issues. So anything related to mental health, you can find in that blog. And I also do a podcast, and so we've done podcasts on chronic pain, trying to explain some of this, and some of those are also linked on there. So a lot of resources on my website. That's probably the best place to go to get any kind of help that you might want.
Perfect. That's extremely valuable. You have a lot of different books that you've written. I think you've written over 20 books.
I have, on worry and marriage, and I was an eating disorder specialist for several years. I worked in that area too, so I've got a lot of books on weight loss and our emotional relationship with food, a lot of things on that. Body image. I have a book called Making Peace with Your Thighs and Other Body Parts. So a lot of fun books on those kinds of things as well.
Wonderful. Well, great resource. I'll make sure to check out the website and share it with everybody as well. But thank you for your time today. I appreciate it. Appreciate what you do to help other people in pain.
Thank you so much.